Hello, and welcome to this Reiki Answer Lady video. My name is Carmen Tracy, and I'm going to be your hostess today. So today I wanted to share some of my experiences while offering Reiki to patients with cancer. So I broke the agenda into a few different sections. Special considerations, treatment side effects, and energies you might experience in the healing session. So my special considerations. The first thing I always like to talk about is what our role is as the Reiki practitioner. Whether you're in your healing space or at the hospital, at the cancer center, your role as the practitioner is to hold your client in wholeness, offering their heart, their mind, their body, and their spirit an opportunity to be reconnected to universal life force energy, or re-reminded of their inherent connection to the universal life force energy. In this way, when we're working with Reiki and cancer patients, our role needs to be especially flexible. I worked out of a clinic called Small Stones. It was a complementary clinic that offered cancer patients a place where they could go and buy organic body care products, get a consultation with a hairdresser. They were able to purchase their wigs there. And then we also offered complementary therapies out of there, one of which was Reiki. The clinic that I worked out of had their own healing space as part of the clinic. And then our role as the Reiki practitioner was also to visit patients in the day chemotherapy room, in the general hospital wings, surgical recovery wings, as well as the bone marrow transplant wings, and palliative care. And so we were frequently all over the hospital offering Reiki to our cancer patients. Part of that flexibility, which is a wonderful thing with Reiki, is that it can be done sitting down, lying down, anywhere or any way that your client, your patient is comfortable. As well, you can do Reiki hands off and hands on. And that was particularly great when, some of my patients were experiencing all over skin sensitivities from some of their different treatments. And so I was able to still, meet them where they were in that moment and offer them a really nice, nurturing Reiki session. There are lots of instances where, you might not be able to bring in your props, for instance. Sometimes when you arrive on a bone marrow treatment wing, for instance, you need to protect your client from outside germs and exposure to things that might cause them harm. And so you're not going to be able to take in, anything but yourself into that session. And so frequently, in that case, you'll find yourself covered with a mask and a hat, or a hair covering and gloves and a robe, and everything, and booties. So be ready and be flexible. And again, the beauty of Reiki is you don't need any of those props anyways. You can just offer Reiki. Some of these treatments, actually most of these treatments, have side effects. Chemotherapy, I know both chemotherapy and radiation have different forms. There are, so your clients, while they might all be having a different series of treatments, overall there might be some common side effects. Chemotherapy and radiation both cause what they call chemo brain, which is overall forgetfulness. As well, some of the drugs that they take during cancer treatments can also cause what they call chemo brain. That can be disconcerting for your client, if they feel foggy or they're, having troubles remembering things. Chemotherapy often comes with the side effect of just generally not feeling very well. It can also cause numbness and tingling in your extremities. Can cause nausea, of course. Some of the treatments like surgery can cause pain. Radiation, if it's a targeted on your body, targeted outside of your body treatment can cause that area to be very, very sensitive and very sore. There are lots of complementary and alternative therapies too that come with their own side effects. For instance, there are some alternative therapies that do a series of juices and enemas throughout the day, and those are going to have their own energies that you might experience in the session. So let's talk about some of those energies. Cancer is a living system. It is an area of your body where those cells, under normal circumstances would have come with complete information or complete instructions, and in this case, they're lacking the instructions to stop growing, and so they continue to grow. In that way, you can offer cancer compassion. You can offer your body, the client's body, your patient's body compassion for what they're going through, and support for whatever the treatment is that they chose to go with. You want to offer their body support and remind their body that it can be part of the healing process. Cancer is a very, very heavy energy, and the stress inherent in that heaviness can be particularly overwhelming. And so as our role as the Reiki practitioner, to not only support our clients as they're going through this process, we can extend that nurturing to family members. Through the clinic that I worked at, their family was eligible to get the discounted rate for a Reiki session. It is a very overwhelmingly heavy energy. I did an advanced or an intensive where we did some field work, and one of the fields that we sat in was cancer, and I was really blown away with how heavy it really is. The treatments all have energy. Chemotherapy has its own frequency, its own signature frequency. And while it comes in different forms, you're exposed to that energy. Radiation is a high energy frequency, and it is very intense. It's very hot. It is, whether they're having X-rays or gamma rays or some type of targeted ray treatment or something internal like a systemic blood treatment or something like that, you're going to be able to feel those energies, and they're going to feel pretty intense. And some of the surgeries have their own energies, and anesthesia coming out of a surgery has a signature frequency. You will come across these different energies in your sessions. Again, as part of our role as a Reiki practitioner, just to offer compassion and nurturing to all of these energies in the healing session, and offer everyone support and wholeness. Offer all of the parts of your client's body, their heart, their mind, and their spirit, to have a place with you to come together in wholeness. I hope that you enjoyed this video. I hope that you've already subscribed to my YouTube channel, and consider sharing this video and other ones that you've liked with your colleagues and your clients. I hope that you visited my ReikiAnswerLady.com website and have seen all of the amazing podcasts that I have for free on my site. I've interviewed some really great guests about their therapies. Super useful information for not only yourself on your healing path, but also your clients on their healing path. I look forward to our continued community building together. If you want to be a guest on one of my shows, get in touch with me. Let me know what your therapy is. Let me know what you're thinking. I would really love to talk to you. If you want to be a guest writer on my blog, let me know. Submit some work. I would love to read what you do and get to know you. Many, many blessings. Namaste. Aho.